Good evening, and welcome to Medical World News' Behind the Science, a program devoted to capturing the varying perspectives from experts around the world on the most pressing topics in healthcare. I'm your host, Gina Morrow. The field of infection control and prevention has changed dramatically in the last few years because of the COVID-19 pandemic. What issues do ICP professionals currently see as the biggest challenge in the IPC profession worldwide? Editors at Infection Control Today spoke to professionals in the IPC field to find out.
I think the main challenge is to get individuals to start focusing on community and public health rather than on personal health and what's good for that individual. That's been extremely hard to overcome. And you hear this all the time, the people who don't want to wear masks for others, they want to do two-way masking. If they're young and vibrant and don't feel like they have to wear a mask, they're not looking out for other people. And we've also become numb to those 400 to 500 deaths a day, along with long COVID. The deaths, I oftentimes hear, well, those are primarily in the elderly. I don't have to worry about it. And it really ignores the strain on the healthcare system, that people with other diseases, even young people, may not be able to get treated, and that that long COVID can commonly occur in younger individuals. And so it's very short-sighted, but that's very hard to overcome. In some cases, this has also rolled over to businesses and workplaces. They're not as safe as what they need to be. Safe alternatives are often expensive. And I feel that workplaces oftentimes look at short economics. They want to make sure they maximize profits and are unwilling to invest in worker safety, which also is the safety of patrons because they're both in the same workplace. And we've seen this in avoiding the cost of increasing air quality with installing, for example, UVC filtration or even HEPA filters. We've seen this with lack of testing, and even not providing high quality N95 masks for employees. And they've also avoided setting aside a few early hours in the morning where people that are at very high risk can come into an area that requires masking by all, including all patrons. And if you just look at what was done at the DAVOS Economic Summit or Economic Forum in Switzerland, many major company CEOs, billionaires, etc., gathered at that forum. And unlike many of their workplaces, they had maximum protections there. It was strongly recommended that everybody was vaccinated. They had mandatory PCR testing before anybody could come into the conference. And this PCR testing result was linked to their badges. So their badge wouldn't work if they weren't tested or had a positive test. I mean, it was really high-tech stuff they had. They had availability of masks and disinfectants throughout the place. And there were even pictures that are on the internet you can see where they were doing an interview and right next to the person was a portable air filter. And on the conferences material that were distributed, it was stating that they've increased to state-of-the-art ventilation and air conditioning in areas that had poor ventilation. And so all of these precautions were done for the executives. But then when you look at the workplace, it's essentially a culture of, I'm young, I'm healthy, I don't need to worry about it. These types of safety precautions aren't being provided. Individuals have been fed that they can, fed this narrative that they can look out for themselves, that as long as they look out for themselves personally, they're going to be fine, when in fact, we're all in this as a community. Unless other people are also doing the same precautions, you're going to increase your risk of getting a disease tremendously, because your chances of getting that disease is not only based upon the precautions which you are taking, but also if you're exposed to the disease by someone else. And that means whether or not they're taking the precautions. So that I think is, so I think that's probably the most important obstacle we need to overcome, is to get people to start focusing on community and public health rather than this individualism that if I don't need to do it or I'm willing to take this risk, that's my right and I'm not going to worry about anybody else.
That's all for today. Thank you for joining us and watching Medical World News' Behind the Science. I'm Gina Morrow. We'll see you next time.